Good morning. It's my distinct honor and pleasure to welcome you to our 2024 Annual Caregivers Conference. My name is Pat Zook. I'm a family physician. I've been in St. Cloud since 1977. And this, our nonprofit, has been going, I can't believe it, like 3 years and beyond. We actually were chartered in 2019, and we had some dreams and ideas way back, as far back as 2016, about building dementia resource centers here and around the state of Minnesota as our ultimate vision. But we started doing dementia evaluations over 3 years ago, and we decided that after several group meetings of up to 80 people from our community and elsewhere, including congressmen, doctors, teachers, a whole bunch of people, that there were too many gaps in dementia care that needed to be filled. And I don't have time to go through all those, but I have we were motivated to do the best job we could for people living with dementia. So we started out a few years ago seeing patients at the Whitney Senior Center who volunteered the first 4 or 5 months. We appreciate that, Paula Wojcicki, who's here. And then CentraCare donated space for us at the plastic surgery building over in the kitty corner from Apollo High School. And we've learned after seeing patients, now we've seen over 200 patients, we also see people not just for dementia, but for dementia prevention. And that we learned very shortly after we started that what we do, 90% of what we do is actually on behalf and for the benefit of caregivers. And it's the caregivers who drive the whole show. And we need to help caregivers be confident in their knowledge of dementia, confident in what to expect from the future. And so we decided in one of our early meetings for public presentations to do this annual caregiver conference. We're especially proud of caregivers who've learned to take care of themselves. And what we teach our caregivers is that they need to take care of their own self. And if they don't, what kind of a caregiver will you be? So we recognize that, and this meeting is devoted to you. And thank you, thank you, thank you. My other job is to kind of go over what to expect from today's events. Right away, we have a wonderful audience here, but we have people online too. So this is October 24th, 2024. We're at the Regency Center in downtown St. Cloud, and thank you folks who are online. Please submit questions. We'll try to answer them during the panel. We may not have enough time. Hopefully you can visit the people doing screenings. The healthcare screenings are to give you an idea how important your blood pressure is, how important your all sorts of things that we're testing, and I'll show you the list of things. Your height and weight, your blood pressure, and all those things are really important. But getting to think about that as a dementia risk factor is very important. So American medicine is concentrated on technology and drugs. We're kind of everything else but that. We do incorporate that into what we do, but we do so much more. But the screenings are there for you, and hopefully you partake of those. The exhibitor hall also has all these wonderful people who do services for folks dealing with dementia. Please visit their tables. They support our effort to put on this conference. Please talk to them and just ask them a question or two, get them talking. They're great people. So we are going to have 3 different individual presentations today. The first one is you see on the schedule at 9:15. The next one will follow right after that, and then we'll have a break. During the break, it's only 15 minutes. Go to the bathroom. There are bathrooms back here. It's not labeled, but there are bathrooms here, and bathrooms outside the hall on every floor. Then after the break, we'll have our 3rd presentation on respite. And then after that, we'll have the decant panel where our team will be present and answering the questions and talking about what we do at our office. Our office is called the Dementia Resource Center Clinic, DRCC. You may hear us call it that. After the panel, we'll have box lunch and then time to also visit the exhibitors again and do some more health screening. So that's the agenda. Talked about the health screenings. Diabetes is huge, blood pressure is huge, depression is everywhere. It's very important that you think about those things, and we brought the screeners here for that reason. If your loved one with you would prefer to have more fun in a place where there are professionals taking care of you, we have a wellness lounge for respite. If your loved one with dementia symptoms would rather go and have some fun there, we have some awesome people doing these fun activities. Ashley and Carrie are going to be there. These are professional people who can be there and help your loved one. And they're going to have a great time, I'm sure. These are some of our sponsors. We appreciate them being here, and Sarah will have tables. Please acknowledge their contribution to this meeting when you see them. Special thanks to all the exhibitors, and then our planning committee. Christina Weischke is into the back of the room. She's kind of been running around like crazy the last, actually 6 months, planning this meeting, and she is so very talented and skilled and so forth. Christina Rodriguez is going to speak today. Tammy has also been very helpful, Tammy Kolwinger, and I'll introduce our staff. So Christina Rodriguez is the one right next to my picture. Christina's going to speak. She's a care navigator and educator. Next to her in the center is Tammy Kolwinger, care navigator, educator, and kind of is the default clinic manager for what we do at the Resource Center Clinic. Christina Weischke, she's the artist. She's the person that's high-tech. If nobody knows how to do it, we ask Christina. And Becky Hoffman is our dementia-informed counselor. She'll talk a little bit more about that during the panel. What is dementia-informed counseling? And what we found is a lot of people married 55, 60 years or so have trouble. And the trouble is new because of this dementia thing between them. And we recognized, and this is not recognized at our big centers, the biggest 2 centers in the state, don't recognize how important it is to get that interventional counseling. And Becky's going to mention a little bit more of that during the panel. So we've incorporated that into what we do, and we found it very important. When you came in, hopefully caregivers got a bag with some respite activity things in it. Each bag will have a combination of some, but not all of these. We also have these coloring books, which board member contributions allowed us to give out. These are fabulous. I like to do some painting and drawing myself, and you could spend hours doing these. These are great, and your loved one, I'm sure, would like these as well. During the panel, each of us on the panel is going to give away our favorite book. Mine is a 36-hour day, and I'll tell you why I like that book. And hopefully you can register for a chance to win these. Also at the resource table, you can put in your name in the hat to be drawn for either of these 2 items. So, again, welcome. Thank you for being here. Thank you to the folks online.